Texas, the Free Market Medical Association is really right at its infancy. We do have 3 chapters that are either open or in the process of opening. In Texas, there really is it's kind of a desert of free market healthcare right now. There are little bitty oases of where the free market is working, but for the most part, healthcare in Texas is controlled by just a few very, very powerful healthcare systems that really resist any kind of true free market competition. The local chapters are really about trying to bring together the buyers and sellers of healthcare goods and services in a transparent, easily understandable way. Right now in Texas and pretty much all over the country, healthcare buying and selling is usually distilled through or strained through an intermediary, through either an insurance company or a PPO network or some sort of a facilitator, what we would call in the Free Market Medical Association. And what the local chapters are trying to do is to get the buyers, the true stakeholders, and the buyers are individual patients, or also in the context of what the Free Market Medical Association is about is self-funded employers. Self-funded employers or individual patients. They're true cash buyers of healthcare goods and services, and they really don't bring an agenda to the transaction. When you see that seller, when they understand who the buyer is, kind of the games that are played right now in healthcare, they kind of lose their luster to the seller, and they say, we can actually, if somebody would be willing to pay us very quickly, reduce our administrative burden to do business, we can get our pencil a lot sharper. Right now, the way the current healthcare system is set up, it's very, very difficult for a medical provider that is better and cheaper to really stand out from the crowd. It's a crazy situation where cheaper and better does not necessarily equate to new patients. So in the free market, those medical providers, again, that are very high quality, very low cost, we call them high value medical providers, it allows them to really be seen and win additional patients, generally from their less efficient, lower value competitors.